Hi guys, it's Granddaughter from Campus Frequency, and today we are live at Model Institute of Health Science and Technology, Iboko, Ebonyi State to be precise. And also guys, we also have Immaculate Conception Schools. That's the secondary school also in the same building, and it is government approved. And today we are here to interview the rector, principals and other students of the school. So guys, follow me as we conduct this interview. The whole environment is very nice, guys. I don't know, I feel so happy and excited about this interview. I really don't know what this interview is going to hold in store for me, but guys, I'm very excited. So join Campus Frequency in our interview. So guys, arriving at the school gate. This is the school gate and this is the security building. Guys, this is like entering a new world of possibilities. I don't know how it's going to be. Honestly, I am nervous, but I'm also very excited. So guys, without further ado, let us enter into the school. And over here guys, we have the canteen. I mean, what is student life without food? We are all humans, we have to eat. So guys, welcome to Model Institute of Health Science and Technology's canteen. So guys, come have a view of the canteen. So next. Good day, sir.
Good day.
So I'm Granddaughter from Campus Frequency.
Yeah, you're welcome.
Can you tell us about this school?
Yes, to start with, I'm Dr. John Upoda, a proprietor, the corrector of Model Institute of Health Science and Technology, Iboko, Ebonyi State. I'm also the proprietor of Immaculate Conception Secondary School, Iboko in Ebonyi State.
When was this school established?
Yes, the Model Institute was established in 2017. We started with secondary school. We had Immaculate Conception Nursery and Primary School, Immaculate Conception Secondary School. So as we grow, now we decide to expand our catchment into education. So we're moving and then to establish a Model Institute of Health Science and Technology, Iboko. So the institution has been very on since that time. The matriculation we did this year was the 7th matriculation since we started. And then we have also graduated a 5th seat for our students. We have gone into fields to help the society. So the school was made established to help people who want to become health professionals, and that for self-employment or for government services, and we are doing well on that.
How many departments?
Yes, presently we have 4 departments, functional departments. We have a pharmacy technician department. We have radiography, medical image processing, X-ray technician. We have a dispensing optician, and then we have a community health programs. So we are in preparation to establish also medical lab science department.
What are the facilities that are available to enable young students learn more?
In fact, we have before you establish the institution, you are given requirements for you to meet up before they can grant you approval to start. Starting from government, government will come and inspect the place, and then determine that the facility we have is enough. We have enough structure in the school, as you can see. The structure we have accommodates hostel accommodations, classroom, all the needed classroom accommodations, library, laboratory, school auditorium, system exam hall, conference offices, laboratory, demonstration room. We have a clinic. We have a X-ray darkroom department. All those facilities are there because there are requirements and conditions for you to have the departments and the institution. So they are complete.
So running a school is not easy. So have there been any notable challenges so far? Why don't you?
That's normally we used to have a student of funding because we depend on the school fees paid by students. We don't get a subsidy from government, so we depend on the school fees paid by students, and then we try to manage it the way we could to make sure that the school is functioning.
Thank you, sir.
Yes.
So far, sir, what are the achievements of the school and the students? Like, what are they?
Yes, as I said before, we have graduated 5 states, and most of them are now employed in government offices. For example, our school was the first institution in the state to establish department of pharmacy, and we were able to train our pharmacy, in which case most of the general hospitals in the state. This is the last employment. It is our students that were employed, our graduates that were employed to those hospitals. Many of the hospitals they are students that are accredited here, that the people who are employed and in charge of pharmacy stations in our general hospitals. Then same thing with medical image. No school is doing a radiography at this level before. We started it, and our graduates are also doing well in various places. Most of them are engaged in both in private and government offices as a radiographer, medical image processing, and X-ray technician. These people are responsible for X-ray management, X-ray technologies. So they are very useful in the healthcare system. We have trained the dispensing opticians, those who produce these lenses. All these lenses you see, we produce them here. I was going to produce them. So they have been trained that they are in the department of dispensing optician. They are doing well there. We have enough equipment for that. So most of our students are there at the theater doing well. So we have a community health department, which came last, and they are doing well. So we have helped the system so well, the healthcare system so well, because our students are everywhere, helping both in public and private places. If you go to the town, most of the big pharmacologists, our students are there. People we trained are there, managing the drugs for them. So we are contributing much to the society in terms of healthcare system.
Okay, sir. Thank you so much, sir. So, sir, if you are given the chance, is there any area in the academics that you would like to improve in this school or elsewhere?
Yes, if I given the opportunity, we are growing. I told you we start from nursery to primary to secondary, now to high. So we are aiming at a university level. We have acquired lands for expansion at Iboko here. So this institution now, we are working hard to get the MBT accreditation so that they'll be doing their HNDs here. Apart from OND, but they will be doing their HND here. So when we graduate from HND, they need to look for university to expand. That's why the expansion area we are looking at.
So, sir, do you have any word of advice for young students coming up?
Yes, there's a lot of them because these days to get employment is really difficult. That's why I advise people to come and read these self-employed courses. Where as a pharmacy technician, if you don't get government work, you can establish on your own. You open up a pharmacy stores and begin to trade people to sell drugs. If you are a radiographer, if you didn't get employment in government, you open up your own and begin to examine people on X-ray, scanning. Most of the pregnant women now, they use smart and they go for scanning. We will open up a place for that and then begin to do that and get money. If you are a community health graduate, if you didn't go to get more work, you establish a clinic where you do maternity health program, the delivering women and some other primary treatments. In areas, most of them establishes a clinic everywhere where you help yourself and society. Just like that. And if you are a dispensing optician, if you didn't get to work in government, you're going to establish you'll be producing a high class and sell and then cure people with eye problem. So the courses we run here are the courses that you can be on your own help the society, because people can be sick in any angle. Either you probably have eye problem, you have issue of another disease where you can begin to look for drugs. So what the courses we do here are very good. That's why I'm advising the youth to read such courses. Not when you go to university, you read pub admin. At the end of the day, you will not get a place to office work to do. If you go to university, read professional courses like law, medicine, nursing, all those things that they are professionals. The society need their services, not the one that the government only need their service, but when the one that the government need their services. So you do that. As a lawyer, if you don't get government work, you establish a chamber and begin to help society. So that is my advice. Let people go and read. Don't say that there's no work, then you just say that there's nothing to read. Be educated. At this level we are. Technicians are very, very needed everywhere. And that is why most of them are even more needed than those with BSc. Because there are some level of people that cannot employ BSc holder. They will employ ND holders. So that's the level we are producing.
Thank you so much, sir. So, sir, please, how can we gain admission into your school if a person is interested?
Yes, normally we begin to advertise for like this academic season. Our advertise will soon start. People came in by buying an application form, 10,000 naira, and then when they come on the day of entrance examination, they come and take the entrance examination. And those who pass, we interview them. If they are qualified to do medical courses, then we admit them. So when they are admitted, now as soon as you pay your acceptance fee, we know that you are accepted and you offer admission. Then we register you as a student. So our admission is not difficult. So if you get the jamba, you come here and do the program. Those who want to be a pharmacist can still come and start from here. After reading a pharmacy at the diploma level, then you still go to university and do a few years to complete the pharmacy, and it will be easier for you to get because direct entry. So people who want to go further can still come here and start it from here. So if you have the opportunity of going around, you see some of our facilities physically. You look at our lab, you look at the main auditorium hall. You can go around, you can see some of the environment itself. You see how we are. We are doing our best to make the environment better. We have facilities. We have a non-stop constant water supply. We have this electricity NEPA and standby generator. When there's no NEPA, there will be a plant on. That most of the things we do require electricity. We're not just like that. We have all those facilities available. We have a hostel accommodation for students who want to live inside the school, both for boys and girls, both for modern suits and both for secondary school. In the secondary school aspect, we are running a boarding house system. So people can come and stay here and read. If you want to join after your graduation, you join the modern suit. You will not pay for admission again. And that's what we do. Any person who read here and they want to continue, not go to buy form again. We waive that for the person. And because the person we believe is our student who is already going from one level to another level.
Thank you, sir. Thank you for your time. So we have come to the end of this interview. Thank you for having us.
Thank you very much.